Hello everyone, I'm Yusuf. I'm a patient consultation expert from Wannabe Taller team. If you don't know yet, our team is specialized in limb lengthening, limb deformity correction and other orthopedic surgeries and related services in Turkey. In our new video series, we will be trying to provide you information about various aspects of limb lengthening procedure, such as budget planning, traveling from abroad, pre- and post-surgery arrangements, what to expect in terms of height gain results, possible complications, pain, difficulties, and so on. And of course, we will also speak about each of the surgery methods. And in this particular video, we will try to put some light on LON method, which is the surgery method preferred by the vast majority of our patients. So let's see first what is LON method. So I move to our slide, and if we look back into the history of limb lengthening surgery methods, the first method used was Ilizarov method, which you can see in these pictures, which involved only external fixation. As you can see in this diagram, there is only an external fixator attached to the leg. The used devices were circular external devices, originally developed by Dr. Gavril Ilizarov in the Soviet Union. These devices were, of course, a big development in orthopedics world, but they have significant drawbacks as well. I'm speaking from the cosmetic surgery's point of view, because these devices are still largely irreplaceable in the world of fracture treatments and various orthopedic surgeries. But in the cosmetic limb lengthening surgery, these devices are a little obsolete because first of all, these devices are big, bulky and heavy. Second, the wires that hold the bone together, you can see probably here, these ones, and also these ones here. These wires are prone to bending and breaking under the patient's weight, and it's not rare that some patients have the deformation of these thin wires, and of course these require replacements or repairs. And third, and probably most important drawback, it's the period of fixation in cosmetic lengthening with Ilizarov method. In other words, the period during which the patients have these devices on their legs, it's quite long. It's the longest among leg lengthening surgery methods. The devices in Ilizarov methods can only be removed if the bones have completely consolidated and have become strong enough. So it's easy to imagine how physically and mentally challenging this period can be. LON method, on the other hand, removes most of these difficulties off the shoulders of our patients. LON stands for lengthening over nails, and this method has two types of fixators used together: an external fixator and an intramedullary nail. If we move to this slide, you will see better. There is an external device, you can see this one, and also like this one is the bone, yeah, tibia bone, and you have a metal rod inside this bone. So it incorporates two types of devices, external and internal, and this is the external devices here, you can see. The external device can be an Ilizarov fixator, like instead of this device there could be an Ilizarov circular device as well, or a monolateral device, which is the rod-like, like a single-sided device, this one, or any other device developed by some doctor anywhere. And it's mainly up to the preference of the surgeon who practices limb lengthening. The choice of device depends on which doctor is doing this operation. Our doctors almost exclusively use monolateral wholly fixed devices, being produced by Ortovia in Turkey. So these devices, you see, they are produced in Turkey, and it's a monolateral device. It's not circular, the classic one, Ilizarov device. And as you can see, the pins are quite thick, and they are much sturdier compared to Ilizarov wires. And because it's much more compact, lighter, easier to maintain, and it's easier to track your lengthening progress on the scale of the fixator, so this device is a lot superior in the scenario of cosmetic surgeries. These devices have bigger advantages. As you can see, on this scale it has a millimeter and centimeter scale. So this photo was made in the middle of the limb lengthening procedure, where patient was still doing the daily bone lengthening. And here you can see it's more than 2 centimeters of height gain. You can see your progress here, and which motivates the patient a lot. And I have to note that it's quite a challenge to have a good sleep while you have traditional Ilizarov devices on your legs for several months, which can cause significant distress combined with the varying degrees of pain throughout the procedure. So since the Ilizarov method is completely external, you would need to carry all these devices for maybe 9 months to 1 year, which can be quite stressful and physically painful and difficult. Okay, we talked enough about the external device used in LON methods, the devices that our team uses. Now a little about the internal fixation. As we mentioned, a rod inserted into the bone, which plays a significant role. Firstly, it adds extra stabilization to the bone by preventing deviations and deformities. Additionally, it allows a much earlier removal of external devices. With this approach, patients only spend 3 to 4 months with external devices on their legs, compared to fully external methods such as Ilizarov, where you would require to have these devices on your legs, the external fixators, from 9 months to 1 year, or in some cases even more than 1 year, because the bones have to completely heal and be strong enough to carry your weight to be removed. But in this method, you get rid of these external ones, and the internal nail remains for the entire period of bone consolidation. The patient doesn't feel that there is a device in their legs, and in the outside you have nothing. You can just live your normal daily life, of course with the exception of physical activities, serious things such as sports or lifting weights. Yeah, and now I would like to give you a little bit of info about the steps of LON procedure. Okay, after the patient undergoes the surgery, there is around 5 to 7 days of hospitalization. This video was made in the hospital, in a typical hospital here in Istanbul, where our surgeries take place. The walking begins from the next day after the surgery by taking a few steps with a walker. So let's see how it happens. You take a few steps like this with the help of a walker. This video was probably made on the next day or 2 days after the surgery. As you can see, it's not very easy because you have had such a serious operation, but it's very important to take at least a few steps after the surgery, so that you begin to adjust yourself, to get accustomed to this. And also walking really helps the bone consolidation process as well. As you can see, these were also these images are from a different patient. This is also the first time walking, where our doctor or an assistant doctor or a nurse or maybe someone from our team, one of the taller team, is always around when the patient takes their first steps to help and to motivate. And then upon discharge from the hospital, the patients are explained how to do their bone lengthening and how to clean the pin sites and change bandages, which are all very important. I mean, keeping these pin sites clean, these ones, are really important to avoid infection. And usually after 3, maybe 4 or 5 days after the surgery, the bone lengthening process begins, and I want to show you how it happens, like how it's done. It's quite an easy procedure that can be done by the patients themselves, so they don't need any assistance. Yeah, you put the key into the hole, it's all explained, and you do a quarter turn, and it's just one act of lengthening, and this is done 4 times a day. So 4 times of lengthening a day gives you 1 millimeter per day. I mean 1 millimeter of height increase. So the same is done for the other leg, of course. By the way, this patient has made this video at home because you can do it at home easily. You can have this treatment period at home and do physiotherapy and exercises and just have a rest. Okay, and patients are free to return home and do the above mentioned things in their countries. I mean, the bandage changes, bone lengthening, and also all the hygiene related things, daily exercises, physiotherapy. But it's strongly recommended to stay in Turkey for the duration of the bone lengthening period, which is usually the first 2 or 3 months after the surgery. So if you stay in a hotel, let's say in a hotel or apartment in Istanbul, you will be able to visit your doctor, or the doctor will be able to visit you whenever there is a need. You have some difficulty maybe, or you want just to have periodical controls, and it's easier to intervene if there is something going wrong. So it's always safer and recommended to stay in Turkey, at least for the period of bone lengthening period. And it's better to return home after your external devices are removed. And the lengthening is done at the speed of 1 millimeter per day, as we said. And at this rate, for example, let's say we want to get 6 centimeters. It's achieved in approximately 60 days because 1 millimeter is done per day. Or let's say you want to achieve 8 centimeter. It will take roughly 80 days, maybe 5 days extra if you add the time of hospitalization. And up to this point, almost all limb lengthening surgery methods have the same sequence. First, hospitalization, the lengthening begins, lengthening is done. And here is what is different in LON method. In LON method, in 2-4 weeks after the end of bone distraction phase, when the bones have shown signs of consolidation, the external devices are removed. At this point, the patients experience a significant relief. The pain has reduced and it has become a lot easier to move around. I mean, after the removal of external devices. And this is an X-ray after the external devices were removed. And as you can see, the internal nail is attached to the bone by means of screws here, these ones. And you can see that the gap is already closing because the new bone tissue, the bone consolidation is happening here. So it's later, it's a lot of time later after the external device removal. And this image was taken after the removal of external devices, and you can see the pin sites here. These get better a lot in the following weeks or months, and there are some slight surgery scars remaining at these pin sites, but if anyone is disturbed with them, they can simply have some cosmetic, plastic surgery to cover up these scars, or they can use creams or laser treatment to reduce the scarring. In this period, after the removal of external devices, it takes around 1 month to 1.5 months to be able to walk without support, and from now on our patients are able to walk, commute to their studies, and go to work, and do most of the things they do regularly, with the exception of sports and other heavy physical activity. These are not allowed until the bones have fully consolidated. And it should be emphasized that the patient has to put real effort in physiotherapy and exercises to improve leg muscles condition. Otherwise, it will take longer to gain mobility and recover completely. You will be recommended a set of exercises to do daily, and at least 1-2 sessions of physiotherapy per week should be taken. And you can have physiotherapy in Turkey, in Istanbul. Here we can arrange that, or you can find a good physiotherapist in your country, but it's a very essential part of any kind of limb lengthening procedure, because the leg muscle flexibility, leg muscles have to adjust to the new length of bone. And it takes approximately 1 year to 1.5 years for bones to completely heal. You will find this out by providing your x-rays to your surgeon periodically, like for example once in every month or 2, and the doctor will decide when it's possible to remove internal nails by looking at these x-rays. Like you can see, there is some bone consolidation, but it's not a completely healed bone, so there is still some time left for the removal of these internal nails, and the doctor will judge this by looking at these x-rays. And we have to mention that the removal of these intramedullary nails are optional. If you want, they can be removed later in your life, or just remain inside your bones if the patient prefers it this way. And I want to tell a few things about why this LON method is preferred by the majority of our patients. Because it's a great combination of a good price and several significant advantages over other methods. First of all, it's much cheaper than the fully internal methods, such as Precise 2.2 method, for example. Precise costs around 35,000 euros. To be more exact, it's 35,250 euros, while LON is even less than half of this price at 17,000 euros as of 2020. At the same time, it's a more comfortable procedure compared with fully external methods such as Ilizarov or Holifix. Almost all of our patients, with some exceptions, have a priority to get rid of these external fixators as soon as possible. And early removal of external devices means less dealing with bandages, pin sites, and shorter time wearing loose trousers to feel comfortable with the fixators. Like, you need to take care of your devices every time you go out, or you want to just maybe buy something from the outside, or you will not feel very comfortable with these devices no matter how small they are. So you want to get rid of these very early, and LON methods allows you to get rid of them early. Also, the external devices are one of the main causes of all kinds of pain and discomfort in limb lengthening patients. So they are a source of pain. These pins are entering your soft tissue and bone. They are causing all kinds of nerve pains and muscle pains, and when you get near the end of the lengthening procedure, due to the stretching, there is also some extra pain, and only one is to get rid of these devices as early as possible. So this is quite important, that LON method has this advantage. So around 70 to 80% of all of our patients prefer this method because it suits their budget, and it also has the before mentioned advantages. Now let's see a few images from our patients. This is our patient from Brazil. As you can see, he had LON method on tibia, on the lower part of the leg, and it's his x-ray. It's after the bone lengthening procedure has finished, but he still waits for the removal of external devices because there is not sufficient bone consolidation here. The bones have to consolidate at least a little bit to be able to remove these devices, because if there is no consolidation, then there might be something going wrong. Of course, it's seen very rarely that patients have slow consolidation or non-union of bone, but it's always better to check and be sure that the bone is consolidating properly before removing these devices. And this is another x-ray from our patient, another patient who is from UK, and he had also LON method, but this one is on femur because as you can see in tibia, for example, there are two bones. One is fibula bone and one is the main bone, tibia bone. In femur there is a single bone. It's located in the thigh, and here the patient achieved 6 centimeters of height increase, and this one is also around 6 centimeters. And this is another patient who also had LON method on femur. This is also a monolateral device, but it's designed a little differently. It's by another manufacturer, but the principle is the same. Okay, thank you very much for watching this video. I hope this video was useful for people who are thinking about LON method or limb lengthening surgery in general. Of course, we have many more images from our patients, like videos, x-rays, photos, but I wanted to show just a few samples to have a better idea. But please keep checking our videos on YouTube and our Instagram and Facebook pages to see more images from our patients, and we always update them, try to get more recent information about how our patients are doing, what is their progress and all. Okay, thank you once more, and hope we see each other next time in our videos, in our future videos. Thank you very much, and goodbye.